I'm Dr. Thornton, and today I brought in my daughter Kate. She's going to help show you guys how to do an at-home impression kit. This is going to be really useful for patients as we're shut down for the next few months and unable to get patients in the office. If you have a need for a replacement retainer, we can use this to get one for you, and it's really the only way we can do that. So pretty simple. We're going to send you a bag, or you can come pick up the bag, and it includes the right size impression tray for you and 2 different types of putty material that you're going to mix together. Okay, so take your impression tray out and then go ahead and open one of those. I'll open the other. All right, you're gonna open the bag, and you don't need to preserve these bags, so you can just tear it open. Get out the 2 parts. Now, you're gonna mix these together, and you only have about a minute to do it. So you wanna make sure to be kind of quick with this. All right, hold on to that for me, Kate. Okay. And the key is to knead them and work them fairly aggressively so that the 2 colors become mostly one uniform color. You don't want to have a lot of swirls in here, and that's going to allow the chemical process to take place and the material to do what it needs to do. So try to get that done in less than a minute if possible, and it should look start to look more like one color. Again, you know, if you've got a little bit of swirl in there, that's okay, but you don't want to have a lot of that. Then the material will set up the way it's supposed to. Okay, you can kind of roll it into a little bit of a hot dog shape, put it into the tray, and push it in there so that it holds in place. Try to get it all within the tray, and that will work. Now, she's my daughter, so I'm not using gloves, and I would recommend that you have a family member help you with this. Definitely don't be having friends over and having them help you with it. Like that.
Good.
Okay, stretch your cheek back, put it in place, tip your head back for me. All right, and then when you put this in, use both fingers to push up on it. You can do it yourself, but it does help to have a family member do it. And you want to push it up until it feels like it's gone about the teeth have gone about halfway into the material. You don't want to push until the teeth touch the tray. And then pull the lip forward. Try to pull the lip over the tray. Hold some pressure toward the back teeth in an upward direction. And don't bite down on the tray while it's in place. Just keep your mouth open a little bit. Try to breathe through your nose. Some of you that have a strong gag reflex may have a hard time with this. Some things that can help with that are, while you're sitting in place, to lift your legs up. Go ahead and lift your legs up for me. Lift your right leg up, Kate, and hold your leg like that. That flexes your abdominal muscles and makes it so that the gag reflex isn't as strong. And you can alternate legs. Go ahead and lift your left leg up now. And continue to breathe through your nose. Now lift both legs up. Ooh, really get those tummy muscles. Okay, now rest your legs again. Kate doesn't have much of a gag reflex, but for someone with that, you know, you might encounter some issues with that. You want to keep this in place for about 3.5 minutes. Okay, so, and that time is important. You want the material to set up completely before you remove it from the mouth. All right, now after 3.5 minutes, we'll be removing this. The tray has been in for 3.5 minutes, so we're going to grab the handle and just pull straight down. There'll be a little bit of suction. All right, and there it is. So this is what you're looking for. You want to have some good definition of all the teeth. You don't want to be seeing the tray through the teeth, and that's why it's important to push halfway up, but to not try to touch the tray on the teeth. And if everything is looking good like this, then we're ready to get this back from you. Spray some Lysol in there all around. Put it back into the bag. Put it back into the other bag for us, and then bring it back or mail it back into us. Okay, when we get this back from you, we can process the retainer and get it back either via mail or via pickup.
Cool.
Thank you.